Welcome to Suzanne's Not a Podcast, number 3. I'm Suzanne Niedermeyer. I'm your host, and I'm very excited to bring you this topic today. I have gotten a lot of people requesting the link to this, so I thought I would hurry up and record it so that I could get into everybody's hands. The title of this is Why Didn't Anyone Tell Me? And the reason I titled it that is because when I'm telling this to my patients, they often use those very words. So I am a speech pathologist. I specialize in voice, swallowing, and upper airway disorders. And I'm going to be sharing with you a common thread in a lot of those issues. And I have seen people deal with difficulty breathing for 30 years, and no one ever told them about this. And once we kind of uncovered the situation, some of those people's lives have been really changed. And I had one lady just in tears saying, "Why didn't anyone tell me this?" And so I know a lot of us struggle with voice, swallow, upper airway issues. Upper airway meaning some people just have difficulty breathing, but they don't necessarily have asthma, but they might. They might have been diagnosed with other things, but I will tell you the common thread that makes it worse. So there might be some of you that say, "Oh my gosh, this is the dumbest thing I've ever heard." And that's okay. You don't have to believe me. But being a speech pathologist and seeing all of these patients, I have the benefit of seeing a boatload of patients. And specializing in those things make me kind of qualified to talk about what's worked for me. Quick disclaimer, I am not a physician. I'm not a medical doctor. And so I am not saying take medication, do not take medication. This isn't the time that I'm going to be sharing plants as medicine. That's a whole different, not a podcast. But for this, we are specifically talking about the throat. So we're also talking about digestion. And we're talking about healthy digestion versus not healthy digestion. So, welcome to Voice Swallow Upper Airway Therapy, because today you are my patient. So what I'm going to be doing is I'm going to be sharing with you what I share with people who have issues. A lot of people come to me and basically their digestive system just doesn't work. And sometimes that's all it feels like to them. But other times it manifests itself in hoarseness, a lot of throat clearing, coughing, irritation in the larynx. So I'll tell you what that looks like. Sometimes your throat gets assaulted with things coming from above, and we'll talk about that, and coming from below. So much so that larynx actually gets cranky. It gets lumpy and bumpy and red and irritated. So you go to eat a chip or a piece of rice or a hamburger, something or a piece of pepper, and all of a sudden it just touches this specific place in your throat and you just start coughing your head off. Does that ring a bell with anybody? It happens to me sometimes, so I know exactly what that feels like. Sometimes it's so bad that you'll be coughing, and then you'll sound like this. Okay? I can do a podcast on that if you guys need me to, but that is something that I see a lot of. That's called vocal cord dysfunction, and that is very, very treatable if the cause is irritable larynx syndrome. So, quick anatomy lesson, so you'll understand what we're talking about here. Okay, digestive system, okay, kind of lower chest up is what I'm going to be referring to. This is the human digestive system. However, it's not really the human digestive system. It's basically a throat, a mouth and a throat. So you guys can see where the nose is. I'm going to be talking about postnasal drainage and how it affects that irritation in the throat. I'm going to be talking about reflux as it comes up from here. So just to get your bearings, this is right here. Sorry about this. This is a mirror view, so it's a little confusing. This is the esophagus. These are your vocal, sorry, let me do this again. There we go. These are your vocal cords. This is your trachea, okay? So you breathe through here and you swallow through here, okay? 2 different holes in your throat. Some people don't know that. I don't know why, but they don't. Sorry for the dogs in the background, okay? This is your tongue, okay? Of course, you can see where the nose is, and we are going to be talking about different things. Vocal cords, as I am looking down in the throat, I do endoscopy, so I look at the camera and I go through the nose down into the throat, and I'm actually able to see all of these structures. And it's really beneficial because I can see what is sometimes causing the issue. So as I'm looking at the vocal cords, and I know this looks weird, I hear it all day long, every single day. These are the vocal cords closed. These are the vocal cords open. So you can see you have 2 vocal cords, okay, right there. Right underneath is the trachea. This is where you breathe. So those of you who smoke, you are going directly or vape, you go directly through those vocal cords into your lungs, and that's why you're hoarse. And that's why we see a lot of throat cancer with smoking, vaping, marijuana use, all of that. If you're breathing anything into those lungs, that's not just air. You are in danger of disrupting the mucosal layer, which of course can cause cancer in any of these structures at all. So avoid that, of course. Now, right here, I want to draw your attention to this area. This is the entrance to the esophagus, entrance to the airway, entrance to the esophagus. You can't see it because it's not going to open unless you're swallowing. This is really important. Any of you ever feel like you have a lump in your throat when you're swallowing, even though there's nothing in your throat? That is typically a sign of reflux. So as reflux comes up through here, through the esophagus, it can spill over into the airway, or not even necessarily into the airway, and create this swelling right here. And so when you swallow, it feels like there's a lump in your throat, because there is, because it makes the tissue swollen. And so you are constantly feeling like you're trying to swallow something, and it's just creating havoc. That in and of itself, that reflux can create the need to clear your throat, because it's irritating to your throat. And the more you clear your throat, the more you need to clear your throat. Because as you are slamming the vocal cords together, you are creating friction, and then your system produces what I like to call sunscreen. So those vocal cords, these little structures produce this white mucus on your vocal cords, and it tries to protect the mucus or the mucosal layer of the vocal cords, because your vocal cords aren't skin. They are very delicate, very, very delicate tissue. So that's important to remember, because we're going to be talking a lot about that. So those people have the issue of possibly becoming hoarse or developing vocal nodules on their vocal cords, or just having that overall feeling of burning in the throat. Sometimes people will experience that symptom of indigestion, but sometimes not. So 60% of patients that have reflux don't even know they have it. They don't have indigestion. So it comes all the way up into the throat. And when it does, it's called laryngopharyngeal reflux, or LPR. Okay? So, laryngopharyngeal reflux can create voice problems, swallowing problems, because you have this stuff coming up or stacking on top of each other. And then you go to swallow and it won't go anywhere. There isn't any room. So, that can be because there's something going on in the esophagus. So, there are a lot of ways to combat that issue. So, one way to do it is to give you something called a proton pump inhibitor or an H2 blocker. So, both of those suppress acid. Proton pump inhibitor is also known as, let's say, what's the most common? Omeprazole, right? Prilosec, Protonix, omeprazole. Those are all designed to get rid of the acid in your stomach so that when it does come up, because it still will, that doesn't keep it from coming up. When it comes up, it just doesn't carry acid with it. That decreases your risk of esophageal cancer. It decreases your risk of throat cancer because all of that acid isn't continually coming up. But you're still going to be bothered by symptoms of things coming back up in your throat, including the throat clear, including the irritable larynx, including the feeling of not being able to swallow. Most of my patients have been on omeprazole or something like that for years and years and years. That medication was never meant for long-term use. That medication was meant for a few months to heal the esophagus while you were initiating good practices of eating and drinking. Now, that piece doesn't seem to happen. Typically, my patients will come to me saying, no one ever told me things that I should eat or drink at all. They just said, here's a pill to get rid of the indigestion feeling. So, the other possible cause of indigestion, this is a vicious cycle, of course, is a hiatal hernia. So, some of you have been diagnosed with hiatal hernia. That also causes reflux. But guess what? The reflux caused the hiatal hernia, or could have caused the hiatal hernia. So again, you're getting all kinds of medication, and some people actually get surgery for hiatal hernia repair, and in a lot of cases, that surgery is very helpful. So I'm not saying get surgery because there are alternative ways as well. I'm not saying don't get surgery. And I'm not saying don't take omeprazole. And I'm not saying don't take Tums. I'm not saying don't take anything. Remember, disclaimer, not saying any of that. But I am going to tell you some things that you can do to mitigate this, the pain or the discomfort in your throat. So, are you ready for this? This is called the I hate you list. Now, some of your symptoms may be you cough or you clear your throat a lot, okay? Some of you might wake up coughing in the middle of the night or when you lie down or after meals. Sometimes people go so far as not being able to breathe at night. Doesn't necessarily mean you have sleep apnea. Sometimes what happens is, remember how close that esophagus is to your vocal cords. When that comes up and touches the vocal cords, their response is to slam shut. That's protective. That's trying to keep things out of your airway because your brain is trying to save your life. So you don't want any liquid acid food particles in your trachea and then into your lungs. So your vocal cords are going to slam shut to protect you. If your vocal cords are closed, this is what happens. There's no air in there because the vocal cords are closed. And what's right underneath the vocal cords? The trachea. There is no way for you to get any air in if the cords are closed. So another symptom you may have is feeling a lump or something stuck in your throat. Another is difficulty swallowing. Something else people may have is pain when they swallow or a sore throat. not the typical sore throat that you just have when you have a cold. This sore throat really doesn't go away. By the way, if you have a sore throat that is persistent, that has lasted for a very long period of time, even a few weeks, you need to get an ear, nose, and throat doctor to look down into your throat with a camera. Insist on it, because there can be very scary things going on in your throat that might cause that won't be diagnosed if an ENT doesn't put a camera all the way in your throat to be able to see those vocal cords and the entrance to that esophagus, just to make sure nothing is growing that shouldn't be there. So highly recommend ear, nose, and throat if you do have a sore throat or difficulty swallowing or things like that. It's important. Okay, so you also might have a bitter taste in your mouth. You also might have a change in pitch, lower pitch, or a hoarse voice. So these are all very common symptoms. You don't have to have all of them. You might have one or two, or you might have most of these. These are common symptoms of laryngopharyngeal reflux. Again, I'm not saying that's what you have. I'm saying by the time a patient sits across the table from me, they've had a lot of tests, and typically they haven't been able to get their problem solved with, the normal medication, etc. So that being said, I'm going to tell you what I recommend, and I do not have this available, so you're going to have to take notes. Get your pen and paper handy. Good thing this is a recording. You can replay it if you need to. Okay, you want to avoid, and don't shoot the messenger. I promise you, this is very helpful. And I also say this is designed to take away most of the things that in many people create reflux. And so we want to take them away. And then once you're all better, we slowly add things back at a time. Okay. So I am not giving you therapy right now, because there is no substitute for skilled therapy. There is no substitute from an ear, nose, and throat visit. There's no substitute for endoscopy to look at the inside of your esophagus to make sure everything is okay. So again, my patients have already had these happen for them. So this is not, I can't say this enough, this is not a substitute for a medical examination. You need to make sure there's not something wrong, and and that needs to be assessed. So I'll probably say that 5 more times. Okay, so if you are sitting across the table from me and you have symptoms of laryngopharyngeal reflux, and you are still having, or you might not know you have this, but you are still having voice, swallow, upper airway, or these common reflux symptoms. If you just have reflux and it's not being helped, these are the things to avoid doing, okay? Avoid caffeine, all caffeine. Yes, all caffeine. Now, disclaimer, if you are drinking a lot of cups of coffee a day, you need to titrate down. So say you're drinking 2 cups of coffee a day. Tomorrow, you want to have 1/4 of one of those cups dumped out before you start drinking it. So you're drinking 1 3/4 tomorrow instead of 2 cups. The next day you dump a half out of 1 cup, and then you enjoy the other half a cup and the other cup later on. So you're slowly decreasing the amount of what you're consuming. Same thing with soda. Soda is highly addictive. It acts on the brain like heroin does. It is very addictive. Don't fool yourself and think you're not addicted to soda. Yes, you are. If you're drinking soda every day, your body is addicted to it. So titrate down, get rid of it. It is really bad for you. Remember, if you have a Coke, and it doesn't matter if it's diet or it doesn't matter if it's sugar, they're both equally as horrible for you. So say you have a Coke and you have battery corrosion in your car. I know this firsthand. Okay. I have a friend that did this absolute thing, so I know this is proven. It's not just something I read about. If you pour that over that battery, that corrosion dissolves. If it can dissolve corrosion on a battery, imagine what it's doing to your throat and your esophagus. It's horrible for you. It's just unbelievably bad for you. So soda has a couple things wrong with it. It's carbonated and it's got a bunch of chemicals in it and addictive, and it has caffeine in a lot of cases. So you want to avoid caffeine and soda, titrate down. Okay, alcohol. Avoid alcohol of any kind. Now, before you guys all scream at me, remember, this is an elimination diet. Once you start feeling better, you get to add these things back one at a time. Okay? So, citrus fruits and juices, oranges, lemons, and limes. Tomatoes and tomato sauces. I know it's getting ready to be tomato season. You just have to trust me on this one. They're acidic, and a lot of times it is a trigger for people. Fried foods and greasy foods, pizza, fast foods, deep fried things. Now, if you're sauteing things in olive oil, that should not be an issue. We're talking deep fried or greasy things. Dairy, only if it's a problem. Now, in some cases, dairy creates a lot of mucus in the throat. Only you're going to know if this creates an issue with you. It may also create bloating or digestive issues, bowel issues. So if it creates any mucus or any of those digestive things, avoid dairy. Otherwise, I don't really necessarily take it out of a diet unless everything else fails, and then I'll take out the big guns, and that's the big gun. That's one of them. Avoid spicy foods, hot sauce, and salsa. Okay? We talked about sodas already. Avoid chocolate. It is, all of these things are acidic, and for one reason or another, they are going to or could create an environment for reflux. Mint and menthol. So people will often take menthol, those Ricola drops. And I think those have a lot of value with some people, but if you are trying to heal your throat and you are trying to get rid of incidents of possible reflux, mint and menthol can both create reflux or set up the environment for reflux. Raw onions and processed meat. So I like to say processed meat, first of all, has sodium nitrite or sodium nitrate in it. Now, it's not the sodium we care about. That's between you and your doctor. But the nitrate and nitrate is like embalming fluid for your meat. So what do I mean by that? Your hot dogs that have nitrate or nitrite in them can last in your refrigerator for a boatload of Sundays. That's because they have this preservative in them. Now, that preservative is a known cancer-causing ingredient. Why it is legal, I really have no idea. I'm not sure, but it can definitely create an environment that is very, very toxic to your body. So, what is sodium nitrate in, or nitrite? Bacon, sausage, ham, hot dogs, Spam, pepperoni, summer sausage, and some lunch meats. So you have to learn to be a label reader and make sure you get uncured or nitrate or nitrite free. Okay, so at this point, people will typically scream at me, "What am I supposed to eat? You just ruined my life. I can't have pizza. I can't go to McDonald's." Well, that's, if you eat food that remembers where it came from, you're probably going to be okay. So, lots of fruits and vegetables. I'm not a big fan of whole grains. I'm not saying don't eat them. A little side note, read Grain Brain. It's worth reading. It was written by a neurologist who specialized in multiple sclerosis, and it is very life-changing for a lot of people. So, but this is an FDA thing, so whole grains are on the food pyramid. Nuts, lean meats, and fish. The less processed, the better. If it's in a bag, if it's in a box, if it's in a can, it's highly processed, and a lot of the ingredients have been stripped from it. So, and it doesn't remember where it came from. So, the less processed, the better basically means, it grows on something or it was alive at one time. Okay, then following these guidelines are really important. So, losing excess weight is on here. However, it's never something that I focus on because when I'm working with a patient, if they are obese, meaning BMI at 30, morbidly obese is BMI of 40 or above. So, check your BMI. If it is 30, you are obese. Your doctor may very well not tell you that because it hurts to hear, right? It hurts to hear that you're obese. It's scary to hear that you're morbidly obese, but you can do something about that. So, part of, eating and drinking this lifestyle that I just told you actually naturally drops weight, but you're not trying. Diets don't work, and don't tell anybody I said that. But diets can be really difficult to maintain and to sustain. So you want to elevate the head of your bed with a wedge, and you can get a wedge on Amazon. And you used to be able to get them at Bed Bath & Beyond, but it sounds like a lot of those are going out of business. So your wedge is going to elevate the head of your bed about 30 degrees, not 45, just 30 degrees. So it's not that bad. It'll take a week of getting used to, but that allows your esophagus to be elevated. And so if you have decreased peristalsis, meaning your esophagus doesn't squeeze hard enough, your esophagus is going to need that gravity to help get that food down while you're laying down. So you want that to be elevated. Exercise with us, or you could put under the head of your bed's legs, you could put 2x4s underneath it. So also, if you're going to exercise, make sure you have a small handful of protein before. Where's my hand? There it is. Okay, so whatever fits in the palm of your hand. For me, before I go on a run, I will eat 1 scrambled egg. If I eat more than that, I feel it when I'm running. If I eat less than that, I'm not going to be able to sustain that energy level that I need. I like protein because it kind of gives you that slow level of energy. It doesn't get you up all high with your sugar and then drop you down real quick. So avoid bearing down or holding your breath while you're lifting anything, including weights, a table, your grandchild, your kid, your spouse. If you're lifting them, breathe through it, okay? Don't stoop down on a full stomach. That includes the dishwasher, dryer. Don't even pick up a napkin. So picture yourself as I'm a little teapot. I'm not calling you short and stout, not saying that. You may be, but I'm not saying it. So there is the teapot like this, and then there's that little spout that goes like this. So that spout is your esophagus, and it's full. So if you tip over that teapot and it's all the way to the top, it's going to spill out and into your throat. So you want to make sure that you are keeping that esophagus straight up and down for a couple of hours. So squat down, hopefully you have good knees, and then grab that napkin or whatever it is you need to do. Okay, quit smoking. If you're smoking, you are increasing that stress hormone, which produces like a fight or flight type of feeling. So it takes all the digestive juices out. It shoots everything out of your stomach to put all the energy in your arms and your legs. Your body does not know the difference between stress from a roller coaster, a gun to your head, or just overall excitement, or you just smoked a cigarette and all of a sudden you got all that energy. Your brain doesn't know the difference. It's going to give you that fight or flight syndrome and create all kinds of problems. So you want to make sure, well, it's not problems if you need to run away from something scary, of course. So I'm not saying that. But I am saying don't create that fight or flight symptom or syndrome unnecessarily. Also, remember that reflux is very, very dangerous when it happens over years and years. It can also spill into your lungs while you're sleeping and create aspiration pneumonia. That is not a normal pneumonia that you get normal antibiotics for. That is a very serious pneumonia that goes into the lung bases, and it is very difficult to get rid of, and in a lot of cases takes you out. And if not that, lands you in the hospital for a good period of time. So you do not want that. All right. And when I say quit smoking, that includes everything that you are inhaling into your system. Okay. Avoid eating and drinking 2 to 3 hours before bed or lying down. That is really key because, well, as you're eating, if you have any issue with reflux, and if you didn't, you wouldn't be listening to this. And if you didn't, you probably wouldn't be my patient. But if you do have reflux, then for some reason things are not draining and going into your stomach, and that trap door isn't closing and keeping things from coming up. So you have to make sure everything is out of your system, into your stomach, trap door is shut, and you're able to go to bed on the wedge. But you need to wait 2 to 3 hours before bed or lying down, even taking a nap. Okay? Avoid tight clothes around the stomach. Ladies, you are guilty of this, and you want to make sure that you are not squishing your stomach, which is going to possibly shoot things from your stomach back up because you're squishing the stomach, making a little bit less room for your food and your drinks. Eat several times a day, every couple of hours. If you eat small amounts, your system is going to be able to digest it a lot easier than if you eat 2 or 3 big meals. I'm not a fan of fasting, like intermittent fasting, where people literally eat 1 time a day. Your system was not designed for that. And by the time you go to eat, you are eating a plate full of 14 ribs and 3 pork chops and beans and potatoes and bread and all the Thanksgiving meals every single night of your life. So you're going to eat really quickly and a lot, and you are going to be setting yourself up for a lot of reflux and a lot of discomfort. And of course, weight gain. So every couple of hours, eat things. People say, well, how am I supposed to do that? I work. Carry an apple with you, a bag of nuts, a bag of grapes, a banana, a slice of, a few slices of cheese, something to get you between meals so that you're not starving every time you eat a meal. Find stress reduction activities, walking, like just kind of leisurely walks where you're listening to the birds sing. Praying is good. That is a great way to digest your food because you're kind of peaceful. Coloring, things that just allow you to just kind of decompress for 30 minutes a day. And then a few other things I tell people is you need to chew your food at least 30 times a bite, even applesauce. Your digestion starts in your mouth, okay? The saliva that you think is sometimes just there to give you something to swallow, it actually is the first part of digestion. So you'll notice if you chew something long enough, it literally goes away, and you'll be saying, where did my food go? Where did it go? I didn't swallow it yet. That's because the digestive juices in your saliva broke it down. Your esophagus does not have teeth, okay? No teeth in your esophagus. So how it leaves your mouth and goes into your throat is how it ends up in your stomach. If you don't take omeprazole and you don't have any other, medication for reflux, you require a lot more acid to break all those big chunks of chicken down because you didn't chew them and break them down in your mouth. A lot of acid equals more reflux. However, if you are on a proton pump inhibitor, those medications that we talked about before, you don't have the benefit of acid in your stomach. So you absolutely have to make sure that you get rid of all of the lumps and bumps in your food before you swallow. So with a piece of meat or chicken, it's going to be a lot more than 30 times a bite. And it is annoying as heck, but you're going to find you feel better, you eat less, and you lose weight. And you're not even trying to. You're not hungry, you're eating a lot slower, and you have less likelihood of choking on your food. Okay? So, those are really important. If you feel like, oh, I need a little bit more, can you help me drop a couple of extra pounds? I'll give you 2 possibilities of doing that. That might help. And I do recommend weighing every day unless you have a psychological issue that makes that very stressful for you, or it creates, something in you, then don't do it. But what I find is people who weigh themselves every day, whether they're trying to gain weight or lose weight, they're able to see trends quickly and make adjustments before it gets out of hand. And so again, that it has to do with weight gain or weight loss, because a lot of my patients need to gain weight. So weighing yourself and making adjustments as you go along day to day, it can be very helpful. So 2 things that you can avoid to see if they are helpful at weight loss. One is dairy. So I had a doctor put my husband and me on a keto diet a few years ago. And it's probably 5 years ago. My husband lost weight. I literally gained 10 pounds. I'm little. That's a lot of weight for someone my size. And I was following it. I was doing all the things, and went back to the doctor, a couple years later. And I said, that keto didn't work really well for me. I gained a lot of weight. And he said, what we're finding is women tend to gain weight with a lot more dairy. Well, that made sense. Okay. Needless to say, I don't eat a lot of dairy anymore. So if you just lose the dairy, then you are very possibly going to lose weight without a whole lot of trying. It does require some adjustment, but it's a pretty healthy thing to do. The other thing you can do is avoid gluten. To me, gluten means glue. A lot of my patients actually have things that have gluten in them stick in their throats. That can create an airway obstruction risk or choking risk. And a lot of times breads will get stuck mid-chest, which is where that lower esophageal sphincter is that we have not talked about. So sometimes you'll eat and drink and you'll feel things get stuck in the middle of your chest. That means 1, you ate something that was maybe gluten and it's sticking because it has a hard time, doing what you need it to do. But second is that you might not have chewed enough. Third, if you do have that feeling often, it is really important to see a GI doctor and have an endoscopy, because that endoscopy will make sure nothing scary is in your esophagus. But they will also be able to dilate a stricture if you have that in your esophagus, meaning a tightening in there where food just can't pass through. A common cause of strictures, of course, is reflux. So no matter what, you need to get a handle on your reflux. So this will I'm hoping this has been helpful for you. Remember to chew your food. Do not choke on your food. Remember, takeaway is your esophagus doesn't have any teeth. I hope this was helpful for you. Just to recap, any issues you have in your throat or with your voice, swallow, or upper airway, you do need to see a doctor about it. Okay, again, I give this information to my patients because they've already had those um, assessments and examinations, and they have been referred to me to help their symptoms. So, again, I hope this was helpful for you, and I will see you at the next Not a Podcast. Have a super blessed day.